been the role of AI, data, and even telemedicine? Has there been an impact? Has that brought about a change?
The journey of data and AI is going to be transformational in healthcare. It's just started. There's already some impact, but what is happening in healthcare, and I think Deepak in one of his previous sessions, Deepak Bagla was talking about how things are moving and changing. Healthcare is going to be transformed with AI, especially. And it's not just an India story. I think India has both the opportunity and also the obligation to create the right model for the global south. That is where technology is playing such a big role. Now, what is data doing? Very simply, healthcare, the way it was working was that all data used to be in some paper somewhere, in some file somewhere. The next phase was that data started getting digitized in some way. It's still early. The next phase is that data is also coming real time with our wearables, Fitbit, this, that, smartwatches. So you get a lot of data and intelligence that starts building around a consumer. Once you have, say, a few million patients, let's take diabetes, over a 20, 30-year time frame, you start observing patterns that there are people going on a certain trajectory, there are inflection points, some go up, some go down, some go southward. As you have more and more data, you realize which consumer is moving in which direction earlier than what traditionally you were able to do. Healthcare traditionally has been only acute care in the sense that it starts when things have broken down, not when the health trajectory is in a certain direction. So what is happening? The big picture here is data and knowledge of a patient's healthcare trajectory is making healthcare more and more personalized, first of all, predictive and preventative. So that almost 80% of the big healthcare spend is actually in the last 10, 15 years of a person's life. And those are all acute events happening at that point in time. If you can keep people fit for much longer, it's actually a cheaper model of healthcare. It's a well-aligned model of healthcare. And that model will happen. And it'll happen sooner than what many people believe. Because what do we have in India? Insane amount of data. We have so much data. We have the talent to make models out of AI models, need that data. We have the ability to do that. And we have a market that actually needs that solution to deliver highest quality at the lowest possible cost. So next 5, 10 years, I would say are the most exciting time in healthcare. What have we done so far is just laid the foundational plumbing. Now comes the phase where the AI work, the data science work will take over.